we'll just wait a little bit to see who else joins us. All right, well, it is 12:01 p.m. Thank you everyone for tuning in today. Wherever you are, we hope that you are safe and healthy. Welcome to the virtual webinar of the Center on Democracy, Development, and the Rule of Law at Stanford University. If you're tuning in for the first time, I'm Didi Kuo. I'm the Associate Director for Research at CDDRL. And today we're delighted to have our own Alberto Diaz-Calleros to discuss federalism and the COVID-19 response. Alberto Diaz-Calleros is a senior fellow at Stanford's Freeman Spogli Institute for International Studies, and he's also the director of the Center for Latin American Studies at Stanford University. Without further ado, we will listen to Alberto for about 30 minutes. If you have any questions in that time, please type them into the Q&A box, and then that will leave a nice half hour for discussion afterwards. So Alberto, please.
Thank you very much, Didi. Thank you for joining us. I have to, first things first, apologize for actually changing the title of the talk. Originally, I had imagined that I was going to be able to give you a rather succinct vision about federalism, comparing Brazil, Mexico, and the United States. The way things have gone is most of the work that I can show you has to do with Mexico. I had warned Didi when she invited me to give to this talk that it would be work in progress. So I apologize in advance for those of you who were expecting. I will touch upon Brazil and the US very briefly, but most of what I'm going to be talking about is about Mexico and some of the challenges that federalism poses for Mexican responses to COVID-19. This map, by the way, is a map from the 1846, in 1846, just before the US-Mexico War. And it's an interesting map because it already shows California, or the Upper California, as not being part of Mexico. The map actually depicts the moment when General Taylor is rallying his troops in Matamoros, about to enter into the intervention in Mexico. And the map actually makes a comment that in this kind of federal systems, it is possible that a place like Yucatan could break away pretty soon. So the map maker is already depicting this kind of fragility and fragmentation that federalism can have. So I'm going to move on to tell you a little bit about the motivation for this talk. And this is related to a post that I put in Medium in March 13 that Didi read, and she wanted me to talk a little bit about it. And I will read this out loud. I'm sorry that you do have it in the screen, but I think it's worth saying, the kinds of thoughts that I had started just, formulating at that moment. And what it says is federal systems of government have the peculiarity of being less capable of acting in unison for a threat such as a pandemic. Federalism protects diverse interests, creating veto points that empower local actors, but in so doing, it is also less able to transmit centralized decisions to subnational levels of government. There is quite a bit of evidence suggesting that for the same reasons, countries organized along federal lines are more unequal than unitary systems. I'm particularly interested in this aspect having to do with inequality. The national state, that's with a capital S, in federal regimes, has less capacity to compensate and equalize when local and state actors, in this case, the provinces, the regions, the states in the federation, block efforts at redistribution. Of course, some federal systems are more unequal than others. US, the Latin American federations, much more unequal than European ones. But the general point is the following. Federal systems, it is harder to shift resources to where they are most needed or to create solidarity among various territorial units because of an inbuilt feature in the arrangement that leads towards uncoordinated decision making. This is something that William Riker, like the big scholar of federalism, had already thought about in the 1960s when he actually pointed out that moral judgments about whether federalism is good or bad had to take into account, in consideration, that federalism in the US protected the possibility of the US South, both during the era of slavery and before the civil rights movement, in the kinds of inequalities and subjections of its population. So he was very clear that federalism was not necessarily a very good system of government. Now, having said this, however, when we think about the three countries that I started pondering on, I want to point out that Mexico, the US, and Brazil have responded very differently to the crisis, as most of you probably know. The Mexican president, in a way, has undermined the response, while at the same time, and this is probably the most interesting aspect, the health surveillance system has something called the Sentinel system, has tracked cases, and to some extent, Mexico is thus far a successful story of delaying a shutdown. This was enormous pressure. The person you have on the left is basically the coronavirus czar, Hugo Lopez-Gatell, Deputy Secretary for Health, who has become this very prominent figure. He goes on a press conference every day. He tries to provide evidence about what is going on, what the strategy looks like. The president was really overshadowed. That's the person behind him, AMLO. And you do know that populist presidents don't like to be overshadowed by other figures. In this particular case, you see on the right, that's work by Sebastián Garrido, the evolution of cases. Of course, confirmed cases are always very tricky because this depends a lot on testing, but the evolution has been gradual, nothing unexpected, nothing like the kind of warnings that people started making about Mexico going the route of northern Italy, of Lombardy, or of Ecuador, of the crisis in Guayaquil. These kinds of things did not happen in Mexico. But I might say, as a side note, that I do not believe President Andrés Manuel López Obrador was too happy with the kind of prominence that Hugo López-Gatell was starting to have in the public sphere. Initially, this is anecdotal, but a week ago still, the press conferences and the stenographic versions of Hugo López-Gatell press briefings were put together with the ones of Andrés Manuel López Obrador, who goes on a press conference every morning in the morning at 7. And now the president actually has put them separately. He doesn't really want them together with his, I think. And he has even warned or said that he might start doing a second press conference in the afternoons after the coronavirus press conference that López-Gatell does. Let us move on to think a little bit about Brazil now. Brazil is different in terms of, again, the Brazilian president undermining the response to coronavirus preparedness. But at the same time, it's such an interesting case because there's so much strength in some other institutions. Fiocruz in particular, I think it is so amazing to see an institution of excellence like Fiocruz that is right now producing 11 million tests. It's doing a chloroquine trial. It's tracking the impact of coronavirus on indigenous peoples. And for example, here I'm showing you one of the Fiocruz recent reports. This is from a few days ago, where they're actually monitoring something which tells you a lot about state capacity. This is how the tracking of coronavirus confirmed deaths compares to the tracking by the death registries in the civil register. So that is the administrative unit of the state that registers deaths from the point of view of local governments, of state governments. How do this excess mortality look? How does this excess mortality looks compared to the records that are being kept by the medical profession, by the medical professionals? And what you see here is this contrast that they point out between Sao Paulo and Amazonas states, in which in one case you have the typical pattern that you have observed in other countries. There is excess mortality that is not being registered as coronavirus deaths. Those are the two lines there. But then you do see that in other states in Brazil, probably because of the weakness of the health sector, but a relative strength of the registry of the administrative side of the state, you actually have more deaths that are being registered by the civil registry than by the health system. So this is like an almost really paradoxical thing. The Brazilian president is probably the only one who has fired a health minister because he was overshadowing him. I think that's the most plausible explanation of what was going on. And at the same time, Brazil seems to be going on a very dangerous path right now, but with some very interesting differential effects. As you go into the US, of course, it is another president who has undermined the response. But it has been the state governors, the counties, the local governments that have responded, generally in a rather uncoordinated way. But what to me is very striking about the US is the polarized citizen opinions, the fact that it is a country where people are still having debates about whether the virus is serious, whether it is really more mortality than the flu. These kinds of things are striking, and of course that they are aligned with some partisan preferences or leanings. But what has happened in the US again is, despite this US president undermining the response, you see that, this comes from the University of Washington work of the Institute of Health Metrics, where they do these forecasting models. And you can see that, for example, Florida, where Governor DeSantis was very reluctant to do a lockdown, to do the kinds of measures, drastic measures that were being effective in other places in the world. What you can see is that the scenarios show this huge area of uncertainty. We do not know whether that state has peaked in the way California has. It's important to know that any of these forecasting models have a lot of range of uncertainty. So we should not just center on the line that you see there with a particular trend. The fact is, the uncertainties in Florida include the possibility that there's still a peak to come sometime in the middle of June, end of July, beginning of July. That's kind of the disjoint nature of federalism. So in some ways, the nice thing about federalism, when you think about it, is that in these three cases, federalism has allowed countries to actually respond in better ways than their presidents. Now, federal regimes are indeed very different from unitary systems in many dimensions. Scholars have discussed how you have the power of governors, this problem of the joint decision trap. At least the European federalism literature talks about it in those terms. Fritz Sharp's work on the fact that you have to make joint decisions, sometimes unanimous or almost unanimous, but you are always almost like trapped in having to make them. We do know that federal systems of government have smaller governments as a whole, like the addition of the state, the municipal or the local, and the federal levels are usually smaller than unitary systems. And of course, the local and the state governments are relatively larger. They have these fragmented and parallel bureaucratic structures because you do have this superposition of the federal and the state. Perhaps federalism is also a place where you have lots of opportunities for corruption and then rent seeking more than in unitary systems, although Parnath Bardhan here at Berkeley has worked on that. My own work has mostly been about questions of what is the bargaining that states can do for fiscal resources and how they use exit threats, the kind of thing that is going on right now in Mexico, where governors who say that they're not getting enough support are saying they would even go all the way to leaving the fiscal federalism pact if they don't get more resources. There is this very, very troubling thing about federalism, in that federalism tends to, I say here, protection. This is the phrase that Pablo Veramendi and I use in some of the joint work we've done on this. It makes sure that inequality, in a way that the system of government does not really create a lot of redistribution among persons from rich to poor, but it does give a lot of horizontal transfers across regions. By design, it will have malapportionment. It will have some Senate and these bicameral budget processes, for example. So, but the most notable are things like the Northeast in Brazil, that always has had a greater weight because of the way the malapportioned system there has worked, and that has resulted in more resources going to those regions. And then it also has this fragmentation and transmission of party discipline is much more complicated in federal systems. This is particularly obvious in a place like India, but even in the Latin American federations, these party systems are less nationalized than in unitary systems. Now, it seems as though federalism, okay, so it is different. We could try to think about what these distinctions make, if they make a difference in terms of coronavirus. And I would say that this is the kind of thing we should not do. Answering the question of whether federalism is a cause of something having to do with coronavirus responses, I think is a little bit of a very, very risky exercise, and to some extent even a little irresponsible. The patterns of the things that are different in federal systems, they're overdetermined because there's so many other things in which these countries vary compared to other countries that might be explaining any difference we see. This graph over here, you've got used to this graph by now. This is the Max Roser and co-authors work on our world in data. And you can see that we just don't have enough federal countries in the world, so we're underpowered for any inference, and they're all over the place. I have highlighted there, don't pay any attention to Venezuela. The Venezuela data is probably nonsense. I've even added a little bit of, countries that are kind of quasi-federal, like Colombia or Italy in there. But generally, the simple point is, I don't think this is the kind of exercise we should be doing in trying to think about how federalism works. Neither should we be doing things like this. As I said, I think it would be a bit irresponsible and even naive to just start running statistical models. This is some work from the London School of Hygiene and Tropical Medicine. They have this coronavirus response team, and they have been doing things, for example, on the transmission, on the how many people are being infected for every case that you have. They also look at, the temporal trends, how many more cases you're getting in a given moment. The places with the more growth of cases, the countries with the more growth of cases right now are mostly federal systems. You see that circled in the graph over there. I've circled all the federal systems. You have, the cases that are quite to an R of 1, which means they have really slowed down the transmission, are all on the right side, mostly unitary systems. I could run a regression and I could claim that there's a, federal effect. I don't think this is the kind of models we should be doing. There's so many other things going on in this process that I don't think we learn much from this kind of exercise. What kind of things are going on? There's just so many confounds that are also correlated probably with this institutional variation, that are related also to things we don't quite understand about the disease and about the way in which this epidemic has evolved, that I don't think we should be trying to do this kind of cross-sectional analysis. Hand washing and hygiene, the more some practices, hugs and kisses, what the president of Mexico was saying, but this more seriously, some people have made this culturally embedded arguments about how some cultures are more likely to have close contacts, family structures, social networks, social distancing and self-isolation. Sweden might actually turn out to be a disaster or a surprise, but they claim that maybe some of the things that they have been doing are equivalent without the government actually telling people what to do. International travel, mobility patterns, climatic patterns. I mean, the list is really long, as you can see, and all these things could be correlated with the institutional variation. I'm just going to mention the last 3, even on those 3, which are supposed to be things that we know something about, the uncertainties we have right now are still so huge that I think we should not be trying to make this kind of cross-sectional comparisons. Let me tell you a little bit about lockdown interventions, about imperfect public enforcement of lockdowns, and about things like essential works and occupations performed by the poor that might prevent you to go into lockdown. The kinds of things we now know, this is, as many of you, I'm also like an avid consumer of a lot of the papers that are coming out on the crisis. And you can see that even something as basic as the R0 or the RE, which would be the factor of transmission, there's enormous uncertainty about what those factors really are. You can find these point estimates. Those are the graph on the left. This is based on the work they did early in Wuhan mostly. And you can see that there's different periods during which you're trying to observe what happens with the initial kind of spread of the disease without intervention. So that number varies from 5 all the way to less than 1. So that's, and these are, serious study, all of them. And then on the right hand, you see these error bands. So even the transmission, you are trying to get to less than 1, but even those, the kind of modeling that is done by the epidemiologists to try to figure out how the countries are going down in that factor, even that modeling is full of a lot of uncertainties. The effect of the lockdowns, I'm pretty confident, I'm pretty sure that the lockdowns are having an effect. They're important in reducing this R0 or RE factor, because this is changing through time, it's not just the initial one. So how much is it changing? this is a recent study where they're analyzing all the data we have for the European countries, the 11 European countries that they had data by March 30th. You see the lockdown can reduce the transmission by 50%, by 25% are the things on the left, on the bottom, public events, closing schools, safe isolation, social distance. This is an incredibly sophisticated study. It uses a Bayesian model of, that really takes into account how also these things are complicated because they usually happen in very close proximity, one day after another, and they look at the sequence at whether one makes a difference when it's done before or by itself and when it's done afterwards, after another intervention. But the thing I want to highlight here is look at how big the error bands are. This is the 95% confidence interval. It is possible that the lockdown in this study saved 120,000 lives in Europe, but it is possible that it also might have only saved about 20,000 lives. And that range is because you see these coefficients. They're extremely, poorly, not very precisely, estimated. And this is the kind of thing we have to be a bit more aware of when we use any of this data as social scientists. Let me show you a third one, which is this one about, staying at homes. So this is a sophisticated study, people who really spent quite a bit of time looking at a lot of the income distribution surveys in Latin America. They use the income distribution surveys to then do occupational profiles, and from those occupational profiles, figure out, who can really stay at home, who cannot really stay at home. Very important exercise, but I think the kinds of things that a social scientist could be tempted to do with this is say, oh, now I have a larger N. I can use 32 Mexican states. I can use 26 Brazilian states. I can put all this into a regression, and now I have a larger N. When you really look at these are maps that basically show you the poverty profiles of the country. They're not necessarily specific about something of coronavirus. Now, what is to be done? What are the things? And I'm going to use my last part of my talk to tell you a little bit about what I think we can do. We can address some modest questions regarding the mechanisms of governance, and federal systems have very specific ways in which they do governance. We have to analyze data with our social science instincts. We have to think about governance, about political incentives, about institutional effects. We need to be a bit sophisticated, or even if not sophisticated, at least rudimentary understanding of some of the epidemiological models. And we do have, I think, a responsibility to fill in some of the gaps in the public policy debates with some of our theories and some of our logics of inference. So let me show you the kind of work I've been doing in Mexico. This is something that I actually have been doing since the Mexican government released the data on coronavirus patients. Now the data set has 110,000 cases of patients that have gone to health clinics throughout the country. Some tested, some not. This is the May 5th release, so I actually spent all morning redoing my estimations on this. Everything is available on GitHub. I am not a user of GitHub, so I apologize. It's a little bit disorganized. And by the way, all the references to all the papers that I've been quoting are linked. There are links there, so I will make sure, I'm sure our CDDRL community through Didi would be able to get access to this, and I will put it in my website as well. So what this shows you, for example, is just if you do an unconditional logic model, very simple, with no other variables but gender and age, you get what we know. This is not a gripecina, this is not a small cold, this is a completely different mortality. These are the estimated mortality rates. You are getting quite a bit of mortality also from people who are negative or who have a pending exam in the Mexican data, probably because they do have coronaviruses. They might have been tested. They might be negative as a false negative, or they might actually, be individuals who are not being, positively identified, but these are probably, part of the excess mortality that we know may happen. So this, okay. Now you can do in these models, you can use all the comorbidity. So the model does include, this is, for example, with all the comorbidity factors, the same thing. You have the ones who tested positive on the right side of any graph, you have the age is what, you see the age gradient very, very prominent. And of course, you have men being more likely to die than women. That is what you see here. And the kinds of things that people have been observing come out here very clearly, renal chronic conditions, so kidney disease, questions of diabetes, chronic cardiovascular problems of various sorts. Not so much smoking. Actually, in Mexican data, smoking, that's the bottom right graph, smoking doesn't seem to be too much of a comorbidity factor. Now, I'm not interested in these ones. The only reason I'm doing them, these are for epidemiologists to do, is because I'm more interested on the kind of institutional performance by different health providers. So having a model that includes all those things, what I am interested in is in this kind of differential profiles and performance by different health systems within a federal system like Mexico's. So Mexico has one system of health which is based on employment, which is the social insurance IMSS system. There's one for state employees, the ISSSTE. We have also people who are attended by private hospitals. And then we have the Secretaría de Salud clinics. That's what people refer to them usually in SAVI now, which would be the clinics that are just for the open users, that are free clinics throughout the country. We see huge differences in the probabilities of death of positive or negative coronavirus patients in this data, according to the institution that is being tending the patient. In the left side that you have there, those are models that include very seriously ill patients, patients that come in with a diagnosis of pneumonia, that are intubated, that go into an intensive care unit and are in a hospital. The left side are women with no pneumonia who have come into a clinic, not a hospital, who have not had any intervention like intubation or intensive care unit. The pattern is still the same. You have these huge differentials. Of course, the error bands on the right one are much different and the scales are different. The probability of dying when you are not a serious patient is much lower. But this kind of performance is what I think we should be looking at. We should be trying to spend a bit more time thinking about how a federal system of government makes two distinct choices on the way a health system is structured. And I have not been able to finish doing the work on this, but I can tell you a little bit what my thinking is. On the one hand, you have the provision of the infrastructure of the public goods, and federal systems generate a particular type of infrastructure in which they might be, particularly the Latin American federations, some kind of lump sum investments regardless of need. And these might actually even put some of the investment into very poor places through some political incentives. On the other hand, public health expenditure, which will be very important for the way in which clinics work, might depend a lot on the kind of fiscal federalism transfers that are in place. So things like the participaciones, which are the revenue sharing in Mexico, or what kind of, if you have something more similar to the German Finanzausgleich, that's a very different kind of setup for how health expenditures are being arranged. We have to be doing work, I think, on how these things vary from federal to unitary arrangements. On the one hand, what's happening with the health infrastructure and what's happening with the current expenditure, and which of these two arrangements ex ante might be better able to withstand a massive shock. In the case of Mexico, and this is work I am working on right now, but we do know exactly where every health establishment is. We know exactly of which of these different institutions, where they are. The red areas you see there are the IMSS, where most of the coronavirus patients are actually dying right now. They happen to be in cities. They're better clinics than the other ones. And then you have these rural clinics. Some of them are called the IMSS Bienestar. They're probably going to be called IMSS Insabi from now on. And the Secretaría de Salud, which actually tend to patients that are not insured, that do not belong to the social security system. And those clinics have huge differences across states and densities within territories. This is what I think we should be studying. The other thing in this kind of framework is you start noticing that there's huge differences among states. So within this statistical model, you can do what is called a fixed effects framework, in which you do like a constant term, but the constant term varies according to the state. These are the simulations, again, of a very serious patient, the simulations of a not so serious patient. And what I want to highlight there is that when the patient is not very serious, or when the patient has a negative test, even when they're serious, the error bands are actually quite close together. The states don't seem to be too different in how they perform. But when you look at the graphs on the right, in very serious and positive coronavirus cases, those differences might be very, very important. So there's some states like Nuevo León or Baja California or Mexico City itself that actually have relatively low mortality rates, even controlling for all the other factors in the estimation. While other states, I'm not going to shame them right now, but there's some states that have significantly higher mortality compared to the rest of the states. So again, I'm not going to be able to tell you right now that I have results on this, but we have a huge literature that tells us a lot about why you might have this kind of subnational differences. There's the question of how federalism shares risks and pools risks. There's issues about how subnational debt and things like bailouts might play out on how these different health systems would be responding differentially. And again, I said transfers at the federal level and formula-based transfers in particular, because health systems, at least in Mexico, are really based on formula-based transfers, how those transfers will play out in creating this differential performance by states. Okay, I'm running out of time. So what I have to say right now is just to give you a sense that to a large extent, a lot of the work we have to do, I think, is within the countries, and it has to do with understanding much more about the inequalities in the health services that are being provided. This, for example, is some exercise I did in San Diego a few years ago, where we were looking at how different the mortality records of Mexico, these are the 2010 ones, you can put population according to their deciles of poverty. So the left is much poorer, the right is much richer, and they are using completely different systems of health, which of course, most of the poor have not got any type of social security, while the ones on the right actually have, a lot of them are actually dying and even being tended in IMSS hospitals. What are the conclusions? Okay, so I don't know if I can really say I have a conclusion, but I really think we have to think theoretically about the substantive problems of state capacity and produce some testable hypotheses of things that happen within federations. No more cross-sectional comparisons among federations or federations versus unitary systems. We have to be more or less sophisticated about how we read epidemiological models, understand that a lot of them are creating simulations. They're not necessarily clinical evidence, and we have to understand their margins of error. We, I think, have to track and document differential responses, and that things like the federal architecture allow us to see a lot of experiences that might be different across states, so we can really use the comparative method of comparative politics. I think we should not shy away from providing urgent public policy advice. We can draw from some of our available provisional social scientific knowledge. We have theories, we can do simulations, we can use observational data, maybe even eventually some experimental randomized controlled trials. But to a large extent, I don't think we have to, the fact that we don't know so many things should not prevent us from saying, well, what we know, we should be putting it in the policy arena. But the one thing I don't think we should be doing is succumbing to the temptation of doing cross-sectional analysis, finding a clever instrument or some kind of natural experiment that seems to be promising. We really have to focus on dependent variables, not on independent variables. And the other thing, which I think is a very serious challenge these days, is we should not be rushing for publication. We have to share our work, get feedback, and receive criticism, which I hope is one of the things I will get right now from you. Thank you very much.
Great. Well, thank you so much, Alberto, for that wonderful talk. We have a few questions coming in. I'll start with Eric Jensen, who's asking that your point on federalism as a cause being overdetermined is a great point, but he's also wondering, given that Brazil, Mexico, and the United States have populist presidents who have been upstaged by their health experts, how do you think about these cases working together in that sense? And Germany is quite different. Merkel has been a very different type of leader, even though Germany is a large federal state. The center-periphery balance there seems to be playing out differently. So how do you think about federalism in the context of these kinds of presidents in particular?
No, I think it's a very good question. And what I sort of feel about it is that My thinking has evolved over the past 6 weeks. So my initial thought was how hard it is going to be for us federal arrangements to respond to this. I was very, very fearful of both our presidents, thinking about my Mexican president, my American president. I have both nationalities. So I was very fearful of the kind of things that we would be seeing coming from them. And then I was very fearful of the kind of uncoordinated action and indecisiveness that a federal arrangement could bring about. It turns out that my revision of that thinking is that now actually my sense of hope on the case of Brazil in particular, because Brazil I think is very serious the way you see the disease evolving there, and whether it will have a different performance also coming into their winter. But in the case of Brazil, I see this strength of the possibilities that come from having governors, from having institutions that are very solid, like Fiocruz that I mentioned. I see in Mexico these highly professional bureaucrats who learned an enormous amount from the H1N1, and that even though, so this one, a crisis in 2009, this is 10 years of learning and experience that prepared them in some ways and can put a stop and put some in a way like a hold on the worst populist tendencies of the Mexican president. And, you know, these possibilities of evidence right now, even I have to say this comment I made about press conferences, the Mexican president will keep on doing his. The American president seems to be thinking that it's maybe better for him not to make press conferences anymore, you know, creating all this incredible uncertainty and lack of trust on citizens. And I think that's, you know, part of the way a federal system of government should work. So I'm actually quite happy about, you know, being a way to temper populists, if I put it that way.
Okay, no, that makes a lot of sense that bureaucracies can be an effective backstop against populism. But there's another question that's sort of similar, that one of the benefits of federal systems is that some states might emulate best practices from successful states or states with better governance. Do you see this happening at the subnational level in any of the countries you discuss? Alternatively, this is somewhat similar. Are some governors coordinating together to form regional pacts like in the United States? Is this happening in Mexico and Brazil? And what kind of effect do you think that will have?
Yeah, so this is a very interesting question. When I started tracking a little bit the evolution of the crisis in Italy, one of the things that was very striking was this difference between Lombardy and Veneto. So two different regions responding very differently. And in some ways, you know, we have the advantage also as we arrived into the epidemic of you know, learned experiences, and that can happen also within countries. Now, having said that, one of the biggest difficulties with the federalisms that Latin American countries have, and this is true of Argentina as well, of Mexico, Brazil less so, but is that there are transfer-led systems. There are systems in which transfers are incredibly important as part of the way in which federalism works. The Sistema Único de Salud, the unified health system of Brazil is a very special sort of system of health, but you cannot understand that system of health unless you understand the way in which the Brazilian federalism has a lot of transfers that are going from the federal level, creating equalization and creating a very different condition from the one we observe in the United States. That is also true about Mexico. Mexico has a whole fund for health, which within item 33 of the budget. The biggest transfer is education transfer, but the second largest transfer is this health transfer, which is basically the one that is paying for most of the hospitals, the doctors, the nurses, the construction of any new infrastructure. So although I think federalism in general can help us see best practices, in the Latin American federations, governments are going to be a lot constrained by how much they can get resources from the federal or the national level. And although you might see marginally some administrative practices, the ways they do things. For the bigger chunk of things which have to do with big public spending on how much nurses and doctors are paid, what incentives you give to research, to development of vaccines and all those things, those will depend a lot on the central level.
Okay. A question here from Jonathan Rodden. Has the Mexican central government distributed any COVID-related extra transfers outside the usual system? And if so, what was the rule for distribution? Because in the US, there's a simple per capita rule with a very high floor for small states, leading to a bizarre series of transfers benefiting states like South Dakota and Alaska.
That is so interesting. So I love those topics, Jonathan, as you know, and I think you understand these things much better than most people about how the way those transfers are going to be allocated. I think my plea is to understand these kinds of formulas, these kinds of rules and how those rules work differently in a unitary system from a federal system, because in a federal system they become really highly codified. In a two-unitary system, you could just have this administrative decision that nobody even figures out exposed once the budget is being reviewed, a year later. In a federal regime, we actually go and bargain and fight over the formulas, and we say, we want this, we want that. In the Mexican case, answering a little bit your question, I think precisely the availability of materials, masks initially, ventilators later on, and the idea that the federal government was not going to give it to the governors that were not co-partisans is what started generating a rebellion of governors around the governor of Jalisco, the Governor Alfaro, who is a very charismatic and an ambitious politician. He might be running for president in a few years. And what he started saying is the federation is not giving me any of the things I need. I am a rich state. I can actually start buying my ventilators. I can start buying the supplies I'm not getting from them. But then why should I keep on contributing with my value-added tax and my income tax on the big federal pool of funding? So this is the fiscal federalism side, which is I think very important. And although I think the threats of exit that he started saying are not really credible, at this particular moment with the fiscal crisis that everyone is going to suffer, I'm not sure that governors can really think they can leave the fiscal federal pact. But at the same time, the threats do have some value. They're not just cheap talk, and they actually can, historically in Mexico, can actually, twist the arm of the federal government to give more resources to these richer states.
Interesting. So there's a question about whether the recent reforms to Seguro Popular by President López Obrador impacts the country's response to COVID-19?
Yeah, so this is a very important question, and I couldn't really explain it in the slides. I made a very fleeting comment of INSABI. INSABI is the new Institute for Welfare in Health, or I think that's what it's called. What López Obrador has done is, in my mind, a terrible thing. He has basically gradually dismantled the two institutions that were doing the most for the poor in Mexico. One was the Seguro Popular that you were asking about. The second one is the Progresa, Prospera, Oportunidades conditional cash transfer program. He attacked both of them from the beginning in his campaigns in different moments as neoliberal, ideas of how you help the poor. And in the case of the Seguro Popular in particular, although the Seguro Popular had many critics and many reasons why it was not working the way it was meant to be, the idea was that it was going to give insurance to all the uninsured. It was going to give a basic package of health that everyone, all these uninsured poor Mexicans who go to these health clinics that are for the open population, that are mostly in rural, smaller towns in the country, for those patients, the Seguro Popular had promised that it was going to be giving this minimum package, and it also promised a whole part that had to do with catastrophic health expenditures. That was a very, I think, with a lot of foresight, we know that sometimes moderately poor families fall into extreme poverty because they have a health shock. And the health shock then, because of the catastrophic expense in health services, in a system, remember the Mexican system does have also a parallel private health providers. It has hospitals and doctors, doctor offices, consultorios that are provided by the private sector. So for moderately poor families, often the debate or the dilemma had been, do I go to the health clinic or do I go to the private clinic, even though I might, be indebted forever? And these kinds of things, I think, were going to be fixed or were meant to be fixed by the Seguro Popular. Unfortunately, the whole plan of transiting into a new health system that was going to be a universal coverage was rejected by many Mexican states. I have not been able to really do all the analysis of why some states did not want to have INSABI. I suspect it is similar to a failure that the federal government had in the 1990s, trying to first re-centralize and then decentralize health services. So the Mexican government has usually not been very successful at creating unified health systems. And that's why you have this patchwork of what are now called the IMSS Bienestar clinics, which are rural clinics paid with funds from the Social Security Institute, but for the open population. Those don't exist in about half of the states. And then now the INSABI, which is going to substitute Seguro Popular, has only been accepted in my recollection about by 20 states. So you get this patchwork, which is a very complicated one. And this is probably the worst time to have this kind of patchwork of health systems working with no coordination.
Right. Is there a relationship between the states that have privatized a lot of the health services and the states that have less?
Not really. So in Mexico, the biggest challenge, I think, is that you have a choice as a citizen to use the private health system. So you can do that. It's very different from the Brazilian system, in which the unified system of health allows you to use public monies to go get attended in a private doctor. So the Brazilian system, to me, is a very attractive solution to this kind of dilemma, because it also generates competition. So private providers are the alternative of public providers. Public providers then have to perform a bit better. In Mexico, because of the strength of the unions and various other issues, I think this kind of proposal is very, very difficult to advance, because to a large extent, and in this particular moment with a left-leaning president who, really rejects anything like that vaguely smells like privatization, I don't see this president really wanting to do like a lot of innovations that would incorporate the private sector into public provision of health services. It is true that they're going to have to do some of that as they are hit by the coronavirus. They will have to, in some ways, compensate private hospitals that are receiving patients. But my feeling is that right now what you have is more richer states, are states where citizens use more of the private sector just because they are richer, they have the purchasing power, and they have insurance in their jobs, and they're able to get better health. By the way, I didn't mention this, but in the graphs of mortality, the private sector patients are the ones that have the lowest mortality, both for coronavirus and the negative and not confirmed cases.
So Tesalia Rizzo, our postdoc, is asking, you mentioned that the US, Brazil, and Mexico are functioning despite their populist presidents, but there's a lot of variation at the state level, particularly when governors themselves might be populist as well, or governors are aligned with the president and therefore might want to undermine some of the best practices for COVID-19. What does this mean for the study of federalism in particular?
Okay, yeah, so this is a very interesting question. I haven't thought it through, but my initial instinct is that the variance in the federal regime should be much larger than the variance in unitary ones. So in some ways, you could have very virtuous best practices, but they might coexist with very poor responses, precisely because federalism allows that kind of space for governors to respond in different ways. I do not know if we will have the kind of data we need to test this kind of things or do it very, very soon, because the kind of countries that have very good regionalized data are places like Colombia or Italy, which in my mind, or Spain, which in my mind are actually work almost like federal systems. So the reason we have data to be able to see this kind of differential responses is precisely because, a department, I don't know how they're called. I don't remember right now how they're called, but they're not governors, but the heads of departments in Colombia actually have a lot of authority. They're called governors, actually. They have a lot of authority about the way they will do things differentially in the scope of policy that they have. So I think you're quite right. One of the things that federalism does is it multiplies the possibility of small populists. There is also a very vibrant literature, I think, in Latin America, trying to think about how you might also allow authoritarian enclaves within democracies. So although you have a democratic country, no question about Argentina, Brazil, or Mexico being democracies, but you are able to create this type of places where competition is stifled, where actually, some kind of cacicazgo, some kind of strongmen are actually running the political system, and there's very little accountability towards the public. So I think this is a topic that is worth researching, and I don't have the answer.
Okay. A question from Magdalena Fittipaldi asks, this is maybe the $1 million question, but what are your thoughts on post-COVID Latin America, particularly from an economic or political perspective? How might the region come out of this? How will it change its position on the global stage? And you mentioned debates about centralization and among the states. Do you think that people's preferences towards governance, towards more or less central authority will change as a result?
Yeah, so okay, of course, we're trying to predict what's happening next month, but my feeling about this is there's two dimensions of it, at least, that I have been thinking about. A couple of them were buried in my slides. I'm sorry that I probably put too many slides, but in one of the slides, there is this brief comment to some of the work, for example, Jonathan Rodden, Eric Wiebel, some other people have done. So one of the things that will happen is, of course, the fiscal adjustment and the deficit. So we've been thinking a lot about the national level deficits, but there's also going to be deficit at the subnational level, particularly if you have rules that allow for getting local debt. And we still don't know what kind of responses we will see there, but I think there's quite a bit of room for state governments to do some either actually very creative and interesting things to kind of smooth consumption. That's what debt, after all, is supposed to be for, if we think about us as consumers. Well, to do something else that is not just investment, although in general, the idea is that this kind of public deficit and debt should only be done because you are doing investment projects. But that's going to be a very important thing that we have to be watching for. The other one is on the very immediate transfer of funds or some kind of compensation to the poor, to the citizens that are being most harmed by the crisis. So there are two types of things there, two types of shocks. So some shocks are going to be on employment, on particular sectors, particular industries, the tourist industry, the oil sector. There's various industries. Mexico is particularly hard hit on the economy. I was listening actually to something that Harvard was doing yesterday on coronavirus and the economic impact. And Gerardo Esquivel was explaining the different impacts it's happening on consumption and the kind of shock this has meant in, he was observing it through credit card and debit card use and the amounts that are being estimated. You can estimate it week by week that way. So we know there's this tremendous effects, hopefully temporary, but some of them are going to be permanent. So the problem is how you have this kind of dislocations in which jobs are lost, new sectors of the economy maybe create jobs, but they might not be in the places where they have to be. And what some countries in Latin America have started doing, which is incredibly interesting, is they really are starting to have a serious discussion about universal basic income. That would put actually Latin America at the forefront in the world if we actually start observing universal basic income starting in some Latin American countries. Brazil and Mexico, unfortunately, are not, I think, the countries where these issues are being more seriously considered, to a large extent, I think, because of the presidents they have in office right now.
That's right. We have a question that's potentially very difficult to answer, which is, there's an assumption that maybe under Obama, you might have different or more effective executive action, but then a lot more rebellion at the state level. I mean, you already are getting rebellion at the state level now, but is there some kind of effective national leadership that in a counterfactual scenario, you could see the states being more coordinated or more cooperative? Is this just a function of leadership, in other words?
So this is so interesting. I think there's two things working at different levels. One is a more symbolic one, which I don't know if we as political scientists are particularly good at understanding it and knowing how it works, or at least political economists. I think of this more as a political economist. We are not very good necessarily at understanding this value of symbolic leadership, but it's the kind of thing that Didi mentioned earlier when she talked about Merkel. I mean, the weight of Merkel in the message and the way in which she was able, I think, regardless of, the maybe some difficulties that the federal regime might have had to give a good response, you can see that, this kind of charisma and leadership makes a huge difference when citizens really need to trust the actions that the government is taking. I mean, these are very strong uses of authority by government. And one of the most terrible things that can happen is that people question in that particular moment whether they just believe government is evil. That kind of debate is the most unhelpful in a crisis like this. But that debate exists, but it doesn't exist in some countries. It exists in a country like the United States. So I think that part is very difficult to figure out, how it works, and when it works, it's almost like when it works, and you see it and you know it. There's a different one which has more to do, I think, with how, and this is very, very complicated, but how budgets and how the formation of public expenditure gets done within the legislatures. And that part, I think, is going to be very interesting. With the Canadians, for example, were able to do this very radical, unanimous decisions about some of the bills they were going to do having to do with expenditure beyond partisanship. I don't see that kind of thing happening in Mexico or in Brazil or in the US. But it is very interesting in this kind of crisis, whether those kinds of, it's almost like the question of whether you can create something like a war budget, a budget that at times of war, everybody agrees you should do. That's probably the kind of thing that some of the political systems should be able to do and put together, and some will not.
Right. All right, well, I think that we're out of time, but Alberto, thank you so much for this wonderful presentation and discussion. This will be recorded and uploaded to the CDDRL YouTube page, and we look forward to what your research produces.
Thank you so much for this, and please do let me know if you have any thoughts and criticisms, advice. I would really appreciate it.
Excellent. Thanks, Alberto, and thank you, everyone. Please stay safe.